Well, I want to welcome everybody to the 2022 Free Market Medical Association Annual Conference. Hope everybody did have a really great time last night at the beautiful Riata for the opening cocktail reception. It's one of our favorite venues anytime that we're in Fort Worth and we get to go to the Riata. It's always a fun place. It's great for seeing old friends and meeting new ones, and we did a little of both of those last night. We have many attendees here, new attendees here this year, so I wanted to spend a little bit of time talking about what the mission of the FMMA is, and probably more importantly, what is not the mission of the FMMA. When Keith and I started this association, we had a very simple goal, and that was to start sharing our experiences of working together in the spirit of beneficial mutual exchange in spite of the healthcare cartel, to create a mostly functional healthcare market in the state of Oklahoma, where we live. I say mostly functional because we still have daily, weekly, monthly challenges that we all must overcome. We still have several large, bureaucratic, price gouging hospital systems, all with monopolistic aspirations that employ way too many physicians in the state of Oklahoma. However, these players are now acutely aware that they have competition. They are on notice. There is not a hospital in Oklahoma that is unaware of the fact that a patient armed with a competitive cash offer, sometimes backed by their employer's self-funded health plan, must respond in kind or risk that patient walking out of their doors. At one point or another, almost all of the health systems in Oklahoma have begrudgingly coughed up a competitive cash offer to retain a patient. That just didn't happen 10 years ago. It was unheard of, as a matter of fact, probably 5 years ago. In fact, some of these hospitals are even willingly participating in the movement, believe it or not, albeit in a clandestine fashion. A lot of them are unwilling to come out of the closet yet, but they're still participating, and we know who they are. In the rural areas, many hospitals have stepped up and are also openly offering bundled cash procedures that are market competitive. But next, I want to share some examples to highlight what Chris had mentioned. We did not collaborate on our presentations, but I was detecting definitely some similar themes. We're of like minds here. But we want to highlight the organic power of the free market and really emphasize and show what can happen anywhere in the country that the market is allowed to function. For example, first off, in 2009, Surgery Center of Oklahoma didn't wait for a network of employers to signal that they were ready to buy bundled medical procedures at a competitive price. They did it anyway. They didn't wait for an insurance company, consultant, third-party administrator to come knocking on their door asking for their price list. They started offering their best bundled cash price for everything that they were capable of doing before they had any assurance of finding enough buyers to make it worth their trouble. As a result of this boldness and success, Surgery Center of Oklahoma now works with hundreds of employers and has cared for tens of thousands of patients and has created many competitors in Oklahoma as well as across the United States. And these competitors are all generally emulating what Keith Smith started and Steve Lantier started. Moving on, Dr. Kyle Rickner and Dr. Robert Lockwood, primary care physicians in Oklahoma that both punched out of their employment contracts at the largest healthcare system in Oklahoma, where they both held very prominent positions to start Primary Health Partners, a DPC clinic. Primary Health Partners is a multi-location direct primary care organization. And these two brave physicians essentially founded the direct primary care movement in the state of Oklahoma. They operate in multiple locations, serving thousands of patients and scores of employers all across the state. And as a result of their boldness and success, they have also earned many competitors and emulators. I'm actually starting to lose track of the number of DPC physicians and locations springing up around our state. Many of these practices are actively working with employer plans as well as individual patients. And then finally, in addition to being a co-founder of the Free Market Medical Association, I'm also the president and CEO, plus the co-owner with my beautiful wife, Kelly, that is out at registration, of the Kempton Group Administrators. We are an independent third-party administration company based in Oklahoma City. And as of a couple of years ago, we are the only Oklahoma-owned and operated TPA left in our state. When Keith and I met in the winter of 2011, and I learned of his unique approach to healthcare, I knew that this was the solution that I had been hoping would someday exist. When I left SCO on that day, this is the day we met, I knew that this would be the model that the Kempton Group would adopt, foster, encourage, and promote to our clients going forward. I didn't know exactly how we were going to do it, but I did know that this would be our future. Honestly, I was at a point in my career that I just couldn't stand living with the status quo any longer. The very next day, my team hammered out a process in which our clients' benefit plans could emulate the cash customer that Dr. Smith was looking for. And within 60 days, we were exposing not one or two of our clients to Surgery Center of Oklahoma's pricing, but all of our clients. We jumped into this movement up to our necks almost immediately. Of course, then it wasn't even a movement. It was just two crazy entrepreneurs. Today, we help navigate our employers, clients, employees, and dependents to Surgery Center of Oklahoma and roughly 160 other high-value bundled cash facilities across the country. And that count doesn't even include the many aggregators that have emerged in certain fields of care like imaging. Green imaging is a great example. We successfully perform this navigation function for over 1,300 patients every single month, and that seems to grow every month as well. As a result of our actions, we too have earned many competitors in the free market redirection space. Some are really good TPAs, and a few of them are actually here in attendance at the FMMA. And others are dedicated care navigation companies. The reason I wanted to share these three examples is that none of the three of us decided to do what we did because the market conditions were right, or we had just gotten some transparency bill passed, or that we had customers lining up demanding that we start a direct care movement. None of these accomplishments were the result of any centralized top-down plan or policy, nor from any assistance from a politician or state government. There have been no big money investments or large corporate interests at work to make this happen. What has caused the expansion of healthcare freedom and market-based pricing in our part of the country has been the open and honest practice of free market healthcare commerce. Where we see similar successes around the country are in areas in which buyers start to demand and seek out high-value, transparent medical providers for their care. Self-funded employers do the same via their TPA or their consultant. These employers incentivize and guide their employees and dependents to voluntarily choose these free market solutions, no matter how small the offering may be at first. If there is only a high-quality free market imaging center in your market right now, choose to support them. Don't wait for a comprehensive network of free market providers to appear before you choose to support these early adopter good guys and gals. If you're a physician or a medical facility considering offering free market procedures competitively cash priced, but are not sure if there are enough buyers in your area, do it anyway. Initially, you don't have to abandon your insurance contracts. In fact, many, if not most, of the free market providers out there still have insurance contracts. However, they do reserve their free market bundles for cash buyers. Buyers that come to them and to the transaction prepared to purchase for the entire agreed upon sale price, not 80% of it, with a large unaffordable deductible that you will have trouble collecting. And finally, not with any pre-certification or utilization review hoops to jump through. Cash should mean cash. If an insurance carrier is willing to engage with you under your cash terms, offer it to them, and then watch them turn you down. You can rest easy that you have offered the carrier the same better deal that you offer your cash buyers, but they rejected it. A pre-discounted price is generally of no use to the insurance companies. The bottom line is, if everyone waits for the market to mature in your area and conditions to be just right before engaging, it'll never happen. The FMMA supports and fosters the early adopter, the doer. We strongly believe in the power of the market, the individual buyers and sellers acting in their own self-interest to provide all the creativity and ingenuity required for success. No policy or legislative solution will ever come close to the wisdom of the market. The quickest way to kill market-based reform is to help it with top-down, centralized planning. It's the organic nature of this movement that has gotten us to this place, and it will lead us into the future if we just let it. To further this end, the FMMA created shophealth.org. ShopHealth is a free to the buyer bundled cash medical search engine. It's paid for by the FMMA member sellers via their association dues. Members can post, edit, and maintain unlimited offerings on the site. Searching for free market procedures and providers of care is 100% free to the general public. ShopHealth has 180 unique medical providers posting over 3,000 bundled medical offerings. These offers could be direct primary care memberships, surgical procedures, advanced imaging, drugs, durable medical equipment, and various others. Please check out shophealth.org. Now to the good stuff. Keith and I are also very excited about FMMA's new association director, Lynn Ann Henderson, president and CEO of Connections. Lynn Ann and her team provided their leadership on a trial basis for last year's conference. And for those of us who attended last year, it was widely acknowledged as a smashing success. To put it mildly, after last year, we were sold on Lynn Ann and her team. They bring a level of organization and professionalism that we frankly have struggled to consistently provide. Sometimes it really shows that Keith and I do have day jobs. We see a bright future with Lynn Ann and her team as she has lots of ideas to continue to up our game and bring additional value to you, our members. Please keep a lookout for Lynn Ann and the Connections team members and let them know how they're doing or if you see something that could be improved. This movement and association deserves an expert like Lynn Ann. Lastly, I want to share with you what Keith and I see as a fundamental requirement for the continued success of this movement, and that is to foster physician independence. Way too many physicians, I almost get choked up, way too many physicians come out of medical school broke and brainwashed into thinking that the only way that they can be successful is to be employed by a hospital system. That has got to change. Enter the Benjamin Rush Institute, BRI. Some of you may have heard of the Benjamin Rush Institute, some probably have not. This is part of their mission statement, though, from their website. BRI believes that the best way to deliver quality, affordable medical care is through a free enterprise system. Yet most medical students today are instructed overwhelmingly in healthcare policy that promotes a government-centric approach to healthcare, and rarely, if ever, encounter a voice promoting free markets and the sanctity of the physician-doctor, the patient-doctor relationship. On some campuses, the government's role in healthcare is not even to be questioned. With that being said, I'd like to introduce to you a brave, independent-minded medical student that also believes in hearing the whole story, not just what is taught by their medical school. Jocelyn Lembombard. Jocelyn is a med student at Oklahoma University. And a couple of months ago, Jocelyn reached out to Dr. Keith Smith out of the blue to discuss her desire to possibly start a BRI chapter at OU and wondered if he might help. Well, after some discussion, and as you might imagine, Keith jumped at the chance to assist. The newly formed BRI chapter meets at Surgery Center of Oklahoma. They've had a couple of meetings so far with Keith buying the beer and pizza. Attendance has been wonderful in this new safe space with over 20% of the entire OU med school in attendance. Keith has also brought in some speakers from a diverse background to sprinkle some seeds of experience and knowledge over the beer and pizza. From bankers to encourage the med students to rent their soul to a community bank as opposed to selling it to a hospital system as they get started, to more seasoned physicians that have learned the hard way why being a hospital is not the panacea that hospitals make it out to be. As we discussed, if these students really are looking for an alternative nation in healthcare, see what I did there? We've got to get them to the FMMA conference. So the Kempton family and the Smith family have sponsored 8 medical students from the OU BRI chapter this year to come to the FMMA and are here in attendance right now. First, Jocelyn, the fearless. Could you please stand up and remain standing to be recognized? Now, could all the other BRI students in attendance please stand up? Woo. Ladies and gentlemen, here is literally the future of healthcare. You can be seated. So we as the FMMA want to see if we can build on this momentum. So if anyone is so inclined, please stop by the registration desk at any time during this conference and make a donation to help out and bring additional students to future FMMA conferences. You can also donate directly through the FMMA homepage. Just click the link, send a student to conference, donate here. These funds will specifically be earmarked just for this purpose. Let's see how many students we can sponsor next year. And remember, the FMMA supports doers. Thank you and have a wonderful conference.